Hey, I'm the Silver Stylist, Lisa Hale, and I'm here today with Dr. Elizabeth Whitaker, which is my doctor, but she's also my really good friend. And so this is Girl Talk with Dr. Elizabeth. So I wanted to come and talk to you about skin because I came to you 2 years ago with issues on my skin. And I have a lot of people that ask me about skin, what are alternatives, things that are going on with their skin, but they don't want to do anything radical like surgery. And so I know when I was here last, we had kind of spoken about different lasers, different things that you're doing, and that's available here at Atlanta Face and Body.
Absolutely.
So talk to me about this.
You know, there's a lot we can do non-invasively. And so if people don't have downtime, they're not interested in surgical options, there are a lot of things that are available. And I think really the best way to think about it is it's all about collagen. We start losing collagen as early as our late 20s, and that process obviously continues. So what we're really focused on when we're talking about texture, lines and wrinkles is really helping to stimulate new collagen. And there are different ways to do that. There are mechanical ways, such as pen microneedling, which I think everybody's pretty familiar with. When you're inducing a little bit of a healing response in the skin. Then there are other things where we start to add energy in, because we know that energy in heating the skin up to certain temperatures will stimulate collagen. And that's when we get into some of the other energy treatments. And there are different ones available. Radio frequency microneedling is very popular right now. And that is a combination of both the microneedling in order to stimulate the healing response, but also delivering that heat energy into the skin to stimulate more collagen so that you're getting a more vigorous response. So there are different, we have a couple of different ones, Bavachi and Morpheus 8, both of which are that microneedling radio frequency energy. We can also apply radio frequency externally. If someone wants no downtime at all, not even the brief downtime we get with the others. And that also by heating the skin will stimulate collagen. So it's all about stimulating collagen, is all about energy.
Okay, so let's talk about, because I know women, we're very familiar with this area. This is a lot of women I talk to, I don't like this area, what can I do? So let's talk about what's available to take care of these areas, especially on the jawline where we tend to show age. As we age, this is the area kind of becomes a problem area with some women. So what are the different options that we have, and what do they do in the downtime with that? And can you do a combination?
Combinations are great.
And that's what and so that's what I want you to explain. So what are the options on those? So if I came in and said, I've got this, I want to tighten this area up, or I don't like how my jawline is getting a little bit, where it's a little bit lumpy, it's kind of up and down.
A little irregular.
Right. So how can I make this stronger, and how can I take care of this without doing surgery? So what would be my options?
Well, there'd be several, and there would be some combination of options available as well. So I don't know a woman who likes her neck. I hear that I hate my neck all the time. So one of the ways we can think about it is if we want to do some deeper support, there are a couple of options. We have another energy treatment called Ultherapy, which is a little different from the other energy treatments. It's microfocused ultrasound. And we're actually ultrasounding the skin while we're doing it. So you're actually seeing what layer you're delivering the energy into. So it's very specific. And you're delivering the energy into the deeper foundational layer that I tighten with surgery. So it's the only technology the FDA is cleared to say that it lifts the neck. So it can give a little bit of a subtle lift to the jawline and the neck. So I think of that as a little more foundational treatment.
Okay, and so what's on that? So if someone was going to come in and get that done, I mean, as far as is it painful? Is it something that has that use like a numbing cream on, or that you would shoot something, or is it there's nothing involved that way? So
we use Pronox a lot, which is a newer offering that's a nitrous oxygen mixture. So it's like what you've had at the dentist, but it's not quite as intense, but it takes the edge off. So if we're doing an intenser treatment like Ultherapy, I get Ultherapy myself, and it's been a game changer for me. I've had it since it came out before there was a Pronox, and it was always worth it to me to go through it, but it was a little intense. And now it's much more pleasant. So there are ways we can make that a very pleasant experience. That can also combine very nicely with doing some treatments more for the surface, like the microneedling with radio frequency, or fractional laser treatments, which create little microtunnels of heating the skin to stimulate collagen. So that's working more on superficial skin tightening, superficial skin texture, and more the surface layer. So if you think about it, your foundational layer, you have a smoother mattress, then you're going to have smoother sheets.
Right.
But you want to ultimately be having both layers be tight.
To where they're tight, to where you don't have a lumpy underneath, and then you have trying to smooth out the top layer. That definitely makes sense.
And we can even take that into more structural support with fillers. Particularly you talked about the irregular jawline.
Right.
We're losing some of our bone as well as our soft tissue and fat, as well as the collagen as we age. So we can use fillers to enhance the jawline or fill in that little pre-jowl area, so that we're again improving that foundation that we're trying to get the skin to lie smoother over.
Okay, and yes, and then we can add fat too, because we lose the fat.
We lose the fat in the face.
Okay, so talk to me about what is the like Morpheus 8, and we also had talked about, because I remember when we came last year and you spoke about skin tight. So those are other options. Am I correct by saying that?
Correct.
Okay.
So again, it's all about energy, and it's all about heat, and all about stimulating collagen. So if you think about it that way, then I think these things start to make more sense.
Right.
So when we're looking at treatments like Morpheus 8, and we also have Avachi, those are both different microneedling and radiofrequency treatments. The Morpheus goes potentially a little deeper and can even do some modeling underneath the skin. So if someone has a heavier neck, maybe has some fatty tissue, that may be a great choice. Okay. Has a little more downtime to it potentially than the Vivace treatment, but both are going to do great collagen stimulation in the skin. We could then step it up if someone has more of an issue, and now we're starting to get into minimally invasive surgical procedures. If someone has more fatty fullness or more skin laxity, there's procedure that is in that, it basically is kind of skin tight, but it's face tight and neck tight. And it works underneath the skin with radiofrequency energy on both the surface and underneath in order to tighten what we call the fibroseptal network, which is that network that connects the skin, and also in order to stimulate collagen production in the skin itself. And I also contour the fat that's underneath. So if someone's got fullness under here they've never really been able to get rid of, and they've got some skin laxity with it as well, it's a great minimally invasive gap procedure. Is perfect for someone who's not ready for a traditional surgery, but needs something a little more intensive than a non-surgical.
Okay, and you can combine those two, like what you could do Vivace or the Morpheus 8 with, and
follow that up after a face tight, skin tight, to get additional skin tightening and additional improvement in the quality and texture of the skin of the jawline and the neck. Absolutely.
Oh, that's very interesting. So, and then also wanted to talk about two things. Because I know we had started talking about this, and this was through the summertime, and these were things that were available. So now we're going into fall. So that changes some. So what are the things that you tend to do more in the fall, because we're covered up more and that are available for our faces?
Well, in the fall, we definitely can start focusing on skin recovery, because a lot of us have seen that exposure over the summer, and even if we're wearing our sunscreen and being good about that, we're still going to get some sun exposure. So then we want to start clearing potentially pigmentation if that's an issue, our browns and our reds. And that's where intense pulse light comes into play. And what it does is it helps lift that to the surface. So I get IPLs myself periodically. And what you'll find is your brown spots get a little darker for about 4 to 5 days, and then they start to lift off. So it helps clear that background pigmentation, give you a smoother complexion. It's a great treatment to combine with doing a fractional non-invasive laser treatment, because we can do those both at the same time very readily. And what that will do will be heat little columns of tissue to stimulate collagen formation. And those two combine very nicely to treat both pigment and then the texture and the wrinkles at the same time in the same treatment.
Right, and so you've got a combination, because you're not only helping the skin underneath, but then you see a difference dramatically on the outside, because a lot of these things are done inside. And are they a build-up thing to where?
They are a build-up. So you're typically going to do, with most of the non-invasives, therapy is an exception, you're going to do a series, typically around 3 to 4, usually spaced about a month apart, so your skin has some time to recover and go through that healing process. And you're building up enough collagen that you really start to see a difference. Some people notice a difference with 1 or 2 treatments, but we're always talking about a difference in the series.
So you would do 3 or 4 of them in a year's time, and you do them through a month. So it'd probably be every other month. So that would be what's fibers.
Usually we want to do a series spaced about a month apart for that initial treatment. And then you could go either, I try to do IPLs, every year after the summer to clear it up, or you can go into a maintenance where maybe you do one every 3 to 6 months just to clear up a little bit of that pigment that we continue to get as we continue to be exposed.
Right.
And of course, skincare is very important.
Oh, absolutely. Too. I mean, that's taking care of your skin every day. These are things that we're doing that unfortunately is damage that we've done when we're younger that we're not seeing until we're much older.
Absolutely.
Because our sun damage, if I'm correct by saying this, our sun damage, we don't see it till 30 years down the road.
And a lot of it's prior to age 18.
Right. And it's too late for them to do anything about it. So then we're just trying to take care of and maintaining what we have moving forward.
Exactly.
As far as any of the Morpheus A, the Skin Tight, any of those, what do they do or what is used? I mean, as far as the pain level. So let's say I've got somebody that's really squeamish. It's not, I mean, so what do you do here at Atlanta Face and Body for pain level for some of these procedures?
Well, we use specially formulated topical numbing that we
get.
It's a combination, and that we use for a lot of our energy treatments to take the edge off and make it more comfortable. We have the Pronox, as we talked about, which we can also use for any of these treatments.
Right.
And that can be very effective if there's still a little bit of discomfort. But most of the time with topical numbing, and these are treatments that I have myself, and it's not, I don't get enough time to treat myself as much as I would like, but I think it's important for me too to understand what the experience is.
Right.
I had talked recently with my estheticians about combining a couple of treatments, and then I had them and I realized that one was a little more intense after the other than I thought. And then I'm like, well, we need to do different combinations and to make sure that it's going to be comfortable for everybody as well as getting results.
Right. And on those combinations that we talked about too, is it something that you can do in the same day, or is it you would do one treatment and then come back a couple weeks later? Or can some of these treatments be done in the same day?
Some can be done in the same day. Okay. The intense pulse light with the fractional laser is a great combo treatment in the same setting to be done back to back on the same day. Radio frequency microneedling probably is best done kind of standalone as a treatment. All therapy can be combined same day with some of the radio frequency microneedling treatments.
Okay.
So there's definitely a lot of combinations that we can do.
Okay, and then you say the downtime for the majority of these, is it about the same time, a week or two, or is it longer than that?
It's really shorter than that for most of it. So if we're looking at the non-invasives, so with microneedling, usually it's about a day.
Right.
If you're looking at the Vivace radio frequency microneedling, typically it's, again, about 24 hours. You're a little red, but you can put on makeup that evening. If we're looking at the Morpheus, it may be a little closer to 3 to 4 days, because it's a little more intensive. The therapy energy, that's more for the lifting, really has no downtime to it. You get a little swelling. I describe it as I may look a little bloated when I look in the mirror, like I would notice it.
Like you ate a little too much salt the day before. Yes.
I notice it, but other people aren't going to really, so it's really no downtime in that sense. When we move up to the face tight, neck tight, those are surgical procedures, even though they're minimally invasive. So the recovery time there is going to be exactly as you said, about a week.
So in the combinations is what I'm...
Combinations, it still tends to be the same recovery. So if you combine a photofacial with a, which is the IPL, and you combine that with the fractionated laser treatment, you're really just going to be a little red for 24 hours. And you can cover it up with makeup. Now you are going to see more of those dark spots lift when we do the IPL. So that's the one thing you have to be prepared for. I mean, I go straight to work with just a little makeup on.
Or even just a moisturizer.
Yeah,
I mean,
you don't want your picture taken, but it's not anything to keep you from
and then that skin slowly sloughs itself off. So then once then that's the prettier skin underneath.
Exactly.
Oh, that's really, I mean, those are all interesting things to know about. So I'm trying to think of anything else we want to talk about. Skin treatment. You've got treatments here as far as skincare that you provide for the clientele.
Absolutely.
I mean, in reference to after one of these treatments that they were that you refer.
And I think that's really important, as you were stressing earlier about skincare, because I think sometimes the tendency is I want to do something and not really be thinking about the fundamental basics and the foundation, which is skincare. And it's really important for people to get into medical grade skincare, because that's really where you're going to get active ingredients that are really going to make a change in your skin. And so we carry several lines that are suited for different patients' needs and different budget points, so that we can kind of cover the spectrum and make sure that we're getting somebody on something that's really going to protect their investment and enhance their investment over time.
Right, and start out early too, because you've got a lot of, I mean, you've got people coming in in the 20s, 30s, 40s, 50s, 60s on up. So it's a matter of starting out early too. I mean, and that's what I've said to my daughter
Mhm.
as far as skincare goes, to start her out early, taking care of her skin, because it's the largest organ we have, and we need to take care of it. And a lot of people don't take care of it, so they start having issues with it.
Absolutely.
Or they wait and do a slack job on what they're purchasing and not doing enough research on it. No, this will do, when they really need to do a little bit more research on what they're using on it.
And I think the younger generation is much more conscious of that whole concept of pre-rejuvenation and doing things early and looking at it as self-care.
Yeah,
And
preventative.
starting that
It's like-
process.
It's like a
very
preventative.
early.
We take vitamins, so we need to do the same thing for our skin as well.
Absolutely.
So-
And there's never too early to start sunscreen. I've got a 10-year-old and I'm trying to stay on
Oh,
her
we
every
should.
day. If you
Oh,
start
my
now,
goodness.
you'll be so ahead of the game.
Absolutely. I mean, we start on our babies when our babies are little,
Mhm.
so it should continue up. I mean, through. Although I will say, when I was younger, skincare wasn't near preached
No,
as it is now.
not at
And
all.
I mean, and I see the results from it. I mean, but it's one of those things that we can pass that forward, move that forward and say, listen, start taking care of your skin, protect it,
Yeah.
keep your sunscreen on. And really the sun is not our friend, but if we do have to be out in it, then protecting your skin is going to be the best thing to do.
Absolutely. Well, if we think about it in terms of energy
Right?
and sun damage,
Correct.
if we've had more sun damage than maybe we can recover from with just photofacials or fractional lasers or the radio frequency microneedling, then we may step up into more ablative skin resurfacing, which is thinking about maybe a little bit more of a minimally invasive procedure. There is some downtime with that. But when I do fractional CO2 laser, what I'm doing is removing some of the damaged skin in these little tiny tunnels that heals with new, fresh collagen.
Right.
And it's also heating the tissue to stimulate collagen again as well. So you get some ongoing improvement even after the initial healing from it. There's about 5 to 7 days of downtime with that. So it's definitely a recovery,
Right. So,
but it's more intensive.
so we're going to talk about fractional lasers.
Yes. So if your sun damage is a little more intensive, you've got deeper lines and wrinkles,
Right.
and maybe the non-invasives are not going to give you the level of result that you want, then we can move into ablative laser resurfacing. So that's going to be actually removing some of the damaged skin and have you healing with fresh new collagen, as well as heating the skin to stimulate collagen. So you're getting an initial healing effect, and you're also getting some ongoing heat stimulation. So that really is going to be more intensive. That's great for deeper lines, deeper wrinkles. Around the mouth is a problematic area for a lot of people.
Right.
So it really can be transformative for the skin.
And
But
that-
it's about 5 to 7 days of downtime.
Okay, and that's the one. So that's the one I was asking you about. Did
Mhm.
Jessica have? Because I think she said that felt like a rubber band, kind of somebody bringing a rubber band back and kind of
And
popping
snapping.
it. Yeah,
And that's the way a lot of the
Snapping it.
energy treatments feel when you get that energy delivery. You feel that kind of little snap and then it dissipates.
Okay, so that's what to expect, even though with a little bit of numbing cream, which will take the most of the pain away, but to kind of feel that popping.
Yeah, you'll definitely feel a little snap, but it's very tolerable, most of the energy treatments. And with the fractional laser, we're doing that with some sedation as well because it's a little more intense, obviously more intensive.
Right. And with that, now you said that as far as healing, so does that mean the skin does it blister up a little bit, or does
It basically will get some little scabbing in particular areas
Mhm.
that will then kind of come off, and you've got fresh pink skin underneath, and then that pinkness lasts a few weeks and then progressively fades, but you can cover it up with makeup after a week. But that really can make the most transformative difference in the skin if there's significant sun damage.
Oh, absolutely. And the products too that y'all are selling here, that you recommend to go along with these is a good thing because you've got that new skin. So you're
Mhm.
wanting to save that.
Yeah, absolutely.
You're not wanting to have no one wants to get a treatment and then turn around and go back into the sun. You really need to protect and take care of that new skin, especially if you're going to have a treatment.
And after any of the recent, that's why the fall is such a great time. After any of these resurfacing treatments, you do want to stay out of stay out of the sun for extended periods of time and make sure you're aggressively protecting your skin.
So that's not an option. Those are not good for the summer because everybody tends to be out in the sun, but great for moving into the fall.
Absolutely.
Yes, and start
Absolutely.
moving. And plus, if you've gotten out and you notice, because I notice spots that'll come up like a freckle or two, and I'm like, oh, that freckle wasn't there last year. So it's one of those things that you can take care of. Those are great options, really good options. We're finishing up with Girl Talk with Dr. Elizabeth Whitaker. And so we'll continue these Girl Talks moving forward. If you all have any questions, DM me or contact me through Instant Messenger, and I'll be more than happy to get the questions to Dr. Elizabeth, and we'll address them next time we meet. And thank you again.
I enjoyed it very much.
I really appreciate it. My friend as well as my doctor, who could have a better community than I do. Y'all take care. Bye.